Anxiety is one of the most prevalent mental disorders with detrimental effects on both physical and mental health. Anxiety has many forms, for example, panic disorder, separation anxiety, and social anxiety, to name a few. But it is commonly described as the overwhelming feeling of dread, fear, worry, and uneasiness. According to the National Alliance of Mental Illness, anxiety disorder roughly affects 19% of all adults in the US, which translates to around 49 million adults per year. On a larger scale, the WHO estimates that a whopping 4% of the global population experiences anxiety. This estimation accounts for over 300 million people. As for children, anxiety disorder is a rapidly growing mental health crisis, with the WHO estimating that roughly 3.6% of adolescents ages 10 through 14 and 4.6% of adolescents ages 15 through 19 experience anxiety disorder. According to the Mayo Clinic, some common symptoms for identifying anxiety include feeling nervous or restless, having a sense of impending danger, panic, or doom, increased heart rate, rapid breathing or hyperventilation, sweating, uncontrollable shaking or tremor, feeling weak or tired, trouble concentrating, problems sleeping, avoidance of stressors, and even abdominal issues. Anxiety could also affect appetite, induce feelings of nausea, and cause body aches. Although the root cause of anxiety is still relatively unknown and understudied, some common causes of anxiety could be due to generalized stress, traumatic experiences, and genetics. It is important to note that generalized stress could come from many settings, such as home, work, and social life, and even health related issues such as a poor lifestyle, which includes the use of or withdrawal of substances such as alcohol and nicotine, for example, disease, disease diagnoses, and injury. Anxiety could also be a side effect of taking certain medications. There are countless ways of reducing stress and treating anxiety, from taking medication to receiving psychotherapy. However, a method that has shown to be effective in treating both anxiety and stress is physical activity. Plus, it's free. According to Harvard Health, physical activity allows for your body to expend and circulate cortisol and adrenaline in your body, which are the primary stress hormones that, in excess, could cause bouts of anxiety and other anxiety disorders. Moreover, physical activity and exercise promotes the release of feel-good hormones such as serotonin, dopamine, and serum beta endorphins that not only boost morale but also drastically change mood. Furthermore, exercise could aid as a distraction from the root cause of the anxiety attack and is a healthy coping mechanism for dealing with stressors. According to Aaron Candola and Brendan Stubbs, various research have also found that amongst the general public, physical activity and anxiety disorders had an inverse correlation. Individuals who did not meet the standard guidelines for physical activity, which are 150 minutes of moderate to vigorous exercise per week with resistance training twice per week, according to ACSM, were at a 32% greater risk of developing anxiety disorders. Furthermore, a study conducted by Martina Svensson and colleagues found that having a physically active lifestyle decreased the risk of developing anxiety disorder by roughly 60%. Through regular exercise and physical activity, body composition changes, level of fitness improves, and the risk of chronic diseases drastically reduces. These slow changes will also aid in the improvement of self-confidence, boost self-esteem, and increase longevity. Not only that, studies have shown that being physically inactive, having lower levels of fitness, and having a higher risk of chronic diseases had a greater chance of experiencing anxiety disorders. The reason why I chose this topic is because anxiety has impacted me and my life in many ways, including the lives of my friends and family. As someone who has experienced bouts of moderate to severe state anxiety and have loved ones who are clinically diagnosed with anxiety, I understand how debilitating it can be when suffering through an episode. Anxiety is a growing issue not only in the United States, but also globally, becoming the most common mental health issue. It has been theorized that the massive rise in anxiety and mental health disorders stem from social media and screen time, resulting in an increase in social anxiety, unhealthy coping via technology, and poor sleeping habits. Research from Travis Slam and colleagues looked at the effects social media had on negative mental health outcomes and found a correlation between social comparison with higher levels of social anxiety. Similarly, research from Holly Shannon and colleagues found evidence supporting problematic social media usage with negative mental health outcomes, pointing towards the detrimental effects social media had on the mental health of adolescents and young adults. In order to help curb the effects of anxiety on adolescents and young adults, it's important to advocate for healthy lifestyle changes. By putting down our phones and beginning to move and be active, we could help bolster the mental well being of the youth as well as those around us.